how about lymphoma risks? They are a bit of a concern. How do you screen for counsel about them, or is that included in what we just discussed?
Yeah, so there's definitely a increased risk of lymphoma in patients who have Sjogren's. Now, I always tell my patients they get very alarmed by that, and I think that's a valid concern. It's not every person with Sjogren's. There's certain features of Sjogren's that makes you more likely than somebody else. Those features are going to include reactive disease, high inflammatory markers, positive rheumatoid factor. There's a lot of things I can look at in clinical history, exam, and blood work that make me more suspicious that this person will head that way versus somebody else. Although I screen everybody. And what do? I do certain blood work. And then again, if I'm concerned, I have a pretty low threshold to say, hey, why don't you go see, my hematology colleagues and just kind of make sure we're all on the same page.
Hmm. What do you find most valuable for patient self management? Hydration strategies, dental care, eye protection, or there's something else that you throw into that mix?
Um, all of the above. And I think also a lot of this comes from good counseling, good patient education, validation, and an understanding of what they can do. So, from a hydration standpoint, I have a lot of tips for managing dry eyes and dry mouth. And then, really, Sjogren's has a lot of components of like fatigue, brain fog, joint pain. So, definitely like advocating for like a healthy lifestyle, which includes like avoiding inflammatory foods, things that we know are inflammatory, smoking, significant alcohol intake, optimizing sleep, mood, minimizing stress, which can be really challenging. But I have that conversation with all of my patients.
Hmm. And how do you collaborate with primary care and other specialties to ensure continuity?
So, patients see us, we evaluate for them, we give them diagnosis. I try to do a pretty thorough note. We usually send that back to the primary care physicians or providers. And then and that kind of varies across, the place. For me, personally, we have a pretty tight knit community, and there I'm open to conversations and feedback. And a lot of my colleagues will call me or text me and say that they have some questions if they do. But we try our best, the best patient care is when everybody is on the same page, and that is something that we could all work on to do better. But we try our best to really make sure everyone knows what's going on. And then the patient also, it's important for them to have, I find if they're the most educated about their disease process, they can also go and advocate for themselves and to the other providers.